dude?
Up, boys?
How you doing, man?
Good, how are you?
So good.
I like the accent.
Thanks, man. I like yours.
Thanks,
Can
brother.
you do an American accent, Matt?
Bald Eagle and George Washington, dude.
It was a little bit of, yeah, you took out the, no.
I don't know. This is how it's worked. I'm from down under, boys.
So Matt, I want to kind of, I've seen your story. I've talked a little bit to you, and obviously Nate kind of knows what's been going on. But I think it's kind of a cool opportunity just to, share like what was happening, and then why you ended up needing brain surgery, and then we'll talk a bit about just like what the recovery process has been like at this point, and if there's been like kind of realizations or how it's put things into perspective for you. But what led up to you needing surgery?
In May, went to the gym on a Saturday morning, like normal day. Went to take the exit on the way home to my house and blacked out. Ran up the back of some lady's car. Wrote my girlfriend's car off. No one got hurt, luckily. But turns out I had a seizure. They're suspected of the temporal lobe. So I had a lot of MRIs, blood work, specialist appointments, and then they found some abnormal grey matter in that area of the brain. So they did a biopsy. So they cut my head open, put my head in the vice, cut the head open, took part of my brain out, sent it off for testing. Still waiting on results, but yeah, it's been pretty gnarly few months.
Was there like any other stuff going on before that, or was it really just that one-time event?
I've never blacked out like that. So yeah, I can't really narrow it down to maybe I've had it since birth and something triggered it, but I'm not exactly sure. I didn't train overly hard that day. I did some chin-ups, some dips, some push-ups, like this normal training. Like I trained pretty hard for most of my life, but that wasn't what I deem a hard training session.
Yeah, definitely not. And what I mean, obviously you're under, you get put to sleep for the procedure. What's that like, waking up and being like, oh, this feels funny?
Well, my head felt about this big, and my girlfriend's mother has family friends that are high up in the hospital, my local hospital. They actually deal with head of the beds and head of pain meds. So I saw someone familiar as soon as I come out. He shot me up with fentanyl and all this other crazy pain meds because my head was really sore. Now, I'm not addicted to it, luckily. But yeah, it's pretty crazy, but comforting waking up, seeing someone familiar. But he said I did really well post-recovery. Like, I'm a pretty positive guy, but it's been pretty rough, to be honest. I'm learning to express myself through this hard period, pretty much.
Yeah, you mentioned right there, like you're usually a pretty positive guy, and maybe there's an instinct to kind of want to like shrug all this off and like kind of smile through it. But are you saying that you're kind of, and I recently tore my Achilles, and I would kind of be in the same like mind state where, like optimistic and whatnot, but like I really for myself let myself kind of wallow in it for a bit, and not try to like put on a face or worry about how comfortable I was making other people with my own issue there. Would you say that that's kind of like something you're figuring out or like working on yourself?
Yeah, I'm trying to just meet myself where I'm at every day because it's different every day when you have a brain injury. I've had plenty of muscle and broken bones and stuff. It's nothing compared to this stuff. But yeah, I put on a face like shit doesn't faze me. But in my own head, I've got an accumulation of shit that's built up for like my whole life. And thanks to Nate Dogg, he's helped me express my feelings. My voice, like I can express my voice more. I feel more confident despite everything that's going on. It's been tough too.
You're working hard at it. I'm proud of you, dude. Just out the gate, you've done a lot to be less of a dummy at yourself. Like the shrugging it off, definitely, there's a value there. There's definitely a value there. But toughing it out sometimes isn't your best route.
I agree 100%. I've been doing it since I was like a kid, so it feels good to actually be a little more present and aware of what's going on. Deal with it as it comes, but yeah, express whatever I feel. And some of the breath work and stuff we're doing, I feel like I can feel the vibration through my whole body speaking. I'm not tensed up in the sympathetic part of my body as much. Like my organs feel like they're moving better, my digestion's better, and they shouldn't be right now, but heaps of stuff, man. I feel, despite everything, I feel cognitively fine. I feel my coordination's great still. Like, just gotta let this shit out that's built up for a long time.
Totally. Yeah, it's like scar tissue, so to speak, emotional scar tissue, but it comes as a byproduct of your behaviors being, you expect them to be a certain way, you know, other people kind of expect them to be a certain way, and then coming to terms with what you're willing to stretch with, what you're willing to make a little bit more allowance in.
Yeah, it's pretty much being more allowing of myself and allowing mistakes. I'm pretty critical of myself, so it's just accepting who I am, basically, and expressing who I really am.
I bet your daughter and partner are appreciating that a good bit, seeing you be nicer to yourself.
Yeah, definitely. I've had some really good days after the hospital when most people would probably be depressed, but I've had some hard times for sure. But I'm just enjoying the time with my daughter, my girlfriend. I'm out in the sun every day. My sister set up a GoFundMe page that's covers my mortgage for like 6 months. I don't need to worry about working for a while, so I can heal. So I'm super appreciative. My local community, family, people online like you guys helping me out. Like, I'm really, really grateful.
Well, it seems like you deserve it. In my short encounter with you, you're a good person. You're not someone that's, I have to question whether or not you're looking for some ulterior understanding, or you're trying to get value but still refuse yourself some kind of, it's difficult to work with someone that's in your position. So to that effect, like if it's because your body's not responding the way that a typical body would just because of the amount of stress that you're undergoing, or if it's like a quality of it's new language, you're not as patient as you might be, or you're not as coherent as you might be, whatever it may be. But you're putting in the work, dude. You're like making it make sense, and even if it doesn't make sense, when it especially doesn't make sense and you feel sick and you feel gross, you're not jumping back into pity party. You're like, let's figure this out. I got a ton to be grateful for. Every moment is a blessing, and you're making it work.
That's how I'm going about it. I'm going to try and use this adversity to become who I want to be, who I've been holding myself back from becoming for a long time. He's in there. Just got to get him out.
Yeah, yeah. You've been walking around. It's like a little dude in a big coat, and you're about to fill out the coat.
Oh, the coat's getting big.
That's
Starting
dope.
to.
Good.
So with like just the immediate aftermath, and I'm thinking about like somebody maybe stumbling upon this like on YouTube or whatever, and they've recently had like a similar surgery or whatever. What can you tell us about kind of your capacity and kind of what seemed to like help you in that like immediate recovery in the first couple weeks, and what maybe you realize like, oh, I got to be kind of careful with like pushing this or this? Were there some insights there that you kind of noticed?
Yeah, just take it easy. I dove like back into biomechanics training and weight training like a week after. People call me crazy, but I felt good. And then my stress tolerance just hit the wall, like Nate said to me the other day. It hit the wall. I done too much too soon. But like 2 days after the hospital, I trained with Nate, did some breath work, different cranial positions. I drained some swelling from the head. That day, felt like it purged down to my stomach, and I spewed it all up. It was uncomfortable, but the day after that, my head felt a million times better. So that's when I knew this stuff was legit, and it's been building off that. Feels like my ribs are expanding in places I'm underdeveloped. Upper ribs, like the pec near the delt, lower ribs at the posterior aspect of the ribs feel like they're crimped under and they're creating this more of a cape. I don't know. That must be a factor in how I can express my voice more, and the vibration travels from my skull down, and I can feel it. I've never felt like that before. It's crazy.
Cool to feel your own feedback, huh? To like have
Oh,
that registry
yeah.
there all the time.
Yeah, well, I'm not telling myself what it should look like or how I should position my hips, so my head over my foot, or rotate my torso one way, hips the other. It's just you take the input from the environment, you react to that, and that creates the output. That's how I think about my rehab at the moment.
Going with the flow in less scientific terms.
So much.
How have you,
Biomechanics is better as a byproduct because of that, to me. More natural.
yeah,
That's
how
awesome.
have you been enjoying the I think it's tri-state breath belt? Like he's got you
Chris
on,
Halliday
yeah,
is a man.
yeah, he's got you on. I don't know if it's a specific program like you're doing from him or whatever, but it looks like from what I've seen, you're often like throwing balls around in different movements. You're playing with an eye patch, like different surfaces you're standing on. Yeah, what's kind of the early experience with that stuff like?
I trained with Chris at the start of this year, maybe just a few times, and I just experimented on my own with like the FP sort of rows and presses, and but mostly it's I'm covering my left eye because I'm left eye dominant. Apparently, I'm not sure if that's a thing, but now it seems to be like pretty smart reasoning. Right side of the head or brain, whatever controls the left side of the body. All my major injuries are on the left side of the body, so that kind of made sense to me. So I'm covering the left eye and then responding to threats, so like metronome or whatever, catching the balls on the beat, or I might do a row to a beat and then look at a visual target on each rotation, or look at a letter chart and say the letter or say a word of that letter to the beat. And the more I'd say like threats you add, the more stressful it is for your brain and the more systems you're incorporating at once. So it's more stressful than people probably think, especially with someone who's been in the stress state as long as I have. So building up tolerance of that takes a while, because it looks like I'm not doing much, but I'm zonked for days after that neural stuff. It zonks me in a different way than physical exertion.
Totally. Well, you only have so much brain juice. A lot of your effort right now neurologically is going to uh, new perceptions. Like as you said, you're learning a bunch of new behaviors. You're allowing yourself to perceive a lot more. So the consumption of material or information is that much greater. So you're kind of going to kid brain again. Like your daughter is a very similar experience that you have, I'm sure, in that you're appreciating more things you're looking at, you're feeling more of your body, you're feeling more of the environment, you're connecting with your body.
100%. I just walk along the beach and fix my gaze. I can still see the waves breaking. I can still see the trees blowing. I feel I'm not a very social person unless I'm drunk. I'm not drinking ever again now after this. But I feel like I can say hello to people and smile at them a lot more now, just from this internal work.
It's beautiful. You notice
This
that you're
gains.
yeah, no, I'm noticing you're communicating with much more ease. So obviously, in having talked to you, Pira, like we had a couple of sessions before your injury, and to the effect of your injury, you were more sluggish with your communication. There was a little bit less like, understandably so, coming off the medication and the like. But in just like a week's time, you're a chatterbox. So it's like a totally different thing to see you talking and enjoying it and not like telling yourself, no, let's stop talking.
I used to hate talking to people unless I was drunk.
Yeah.
100% honest.
Well, it's very cool to see that you're doing it so comfortably, because it's not like you're, if you were to not make any things clear to me or Ben or whomever about you having an issue with that, The only thing that I would know is that you're working through an injury right now, but you enjoy engaging.
I'm enjoying the process, as crazy as it sounds. It's
good.
leading me to the truer self, so to
Stress is
speak.
strong, baby.
That's it.
Does
Yeah.
it kind of reframe just your thoughts on training in general? I mean, you've tried a lot of different things, and now in the midst of this recovery, you're trying even some new stuff and really trying to just support your own like primary systems of breath and of like circulation and whatnot. Does that does that kind of make you think like, oh, even if I wasn't like, or when I'm closer to 100%, I'll still try to train the same way? Or if I was training somebody else, like maybe I would want them to do some of this stuff now instead of like stuff you might have thought was really the building blocks before.
I think nervous system regulation and breath work is more foundational than contralateral reciprocation. That's my thoughts. Even if you believe we evolved from the apes, we had to breathe and have blood pumping through our body, lymph, all this stuff before we could do this. That's my interpretation of right now. So yeah, I would start them off with breath work drills and deep pressure therapy, touch base exercises, depending on their restrictions. I definitely would start from the basics. Gee, I used to think the basics were tuck your butt, extend your T-spine, which seemed to exacerbate my stress levels, and they were already pretty high.
Totally. You make more sense of the sensory processing dialogue, like input, processing, output. You gotta receive the input, process it before you can generate a stable or functional output.
Yeah, well, if someone's trying to fight me down the street, I'm not going to carry my mirror and have someone cue me how to dodge a punch. That's my thoughts.
Yeah, you keep it reflexive, you keep it in the moment.
100%.
Just trying to share the head injuries with other people, huh?
I'm not trying to I'm not trying to dig out any systems because they all have their value, but
Yeah,
they're not really applicable to me at the moment.
totally. But like you said, it's improving whatever you are doing biomechanically. So like if you're doing some of your twisting cable exercise or lifting or rowing or whatever it is, as you talked to me in session, your pressure management is better, your coordination, the behaviors is better, your muscle recruitment is better. It compounds well. It adds to the process. It lets you get back into things you like to do quicker.
Yeah, I'm not losing muscle. I'm probably getting bigger in the torso, and I'm only doing isolated breath work, as some people say.
Yeah,
It's isolated because it seems to pump areas where I'm underdeveloped, specifically the neck,
totally.
my face. I feel blood flowing down like the axillary line, all the way down to my hands, like crazy stuff. I can't really describe it in words because it's sensory based. But if anyone has doubts, just try it and then make a perspective based on your own experience. Don't just piggyback off someone else's experience.
So that's a good segue. You say make the decision based off your experience or your perspective. Um, where before you were pretty fixed on what you think was good and like working for you until it wasn't. How would you give someone the clarity that self-limiting values or your perception of doing something right becomes secondary to you feeling good in your body? I mean, if you don't have a perspective of what feels good, how would you know?
Well, you can't.
Yeah.
But a lot of these other modalities are pushing what's right based on their preconceived notions of what they think is right. Just because an athlete moves a certain way, they have a completely different anatomy to you, completely different trauma emotions to you, like all these other factors that come into play. It's not just how you position yourself before you move forward. So I'd say learn about the sensory input process first and then react to threats to your environment, like stimulate the brain in all the systems of the brain and then create the output. If that doesn't improve your mechanics, I'm not sure what will, because That's how we move naturally.
Brad, it's cool to hear you say that in the opposition, because for a while I was trying to convince you.
I still like to do that training. Like there's
Yeah.
value in that training. But now I'm like more. My thinking's more movement variability and strength in different contexts. Not you have to be exactly in this position. You need to pressure exactly in this area, and then you need to sequence this, and this for this to be optimal. That's not how I look at it anymore.
Totally. Has your striking improved? Have you done any?
I haven't done any for years, but I can still punch on.
Yeah. So I'd be interested to hear how you feel it. How you feel it goes a little bit different, because I mean, it's all sensory processing. So
100%.
how do you create your rhythm now?
I feel a lot more bouncy on my feet, to be honest, and in sort of like a transition between striking and wrestling, like taking a shot. It's a lot of deep knee and hip flexion. That used to hurt me because of the ACL injury. It's pretty much why I stopped training MMA about 5 years ago. And now I can get in these deep positions and no problem at all. And I tried the biomechanical route for a long time. And it's just me feeling safer in my body, basically. I can achieve these access to ranges safely.
Yeah. What do you mean by safely? Like, how would you describe that for someone that hears you have your teddy bear with you?
Without me feeling fear of putting my knee in that position, basically, without it having the shake, the tremor, because it's not stable in that position.
Yeah.
Like whatever position when I snapped it, I was in, that's going to be a stressful position for my system when I load it. But now I've calmed my system down a little bit. My body seems to just react to it less severely, like it's accepting.
Would it be fair to say you've improved your proprioception without necessarily training proprioception through there?
100%. I still feel just as agile as I used to, and I haven't trained in a long time, like that specifically. I had a punching bag out the back. I used to punch once a week. That's it.
Yeah.
But yeah, I haven't trained MMA for like 5 years, or wrestling or punching or anything. I still feel just as sharp as I used to.
It'd be cool, I think, just off topic, the perturbations that you experience from doing that, especially being in a familiar movement cycle. If you're up for it, run through some like light movements and let me know how you feel.
Yeah, I will for sure. I just went a little too hard too soon last week, and I felt a bit shit from that. So it's calmed down.
Good. You're not rushing it. Yeah.
No.
I remember you telling me that you were feeling a little rough from we had a good session, and then the next day you're like, let's see how much I can do.
Yeah. I went to the gym and like PR'd on dumbbell bench. I hadn't trained dumbbell bench in like 5 years.
Yeah.
So it's good and a bad thing.
It's cool you're wanting to do it. I mean, that's a huge provider of excitement, and that's what I was talking about. We had a previous conversation with Johnny just not too long ago. If you're excited about doing things that you don't have a background in, or if you haven't experienced enough of as late to have a muscle memory, or even just like a recent memory of, but you're like, I can do this and I'm excited to do this. That's all of what life is about. Like we have less precipitation of this is going to go bad. We're more excited to do it because we believe in ourselves, or we believe that we're tolerant enough to handle it.
Yeah, well, even talking to you 5 years ago, I just been too anxious or nervous to even do it. So
That's some cool growth, dude.
Always positive and negatives, brother. That's how I'm trying to look at it.
Proud of you. You're killing it.
Yeah, man. Well, I don't want to keep you too long. Keep you on your screen. I'm sure. I imagine that's one of the things that you probably have to like manage that even more now, because just like looking at a phone or whatever, it'll mess with you.
I'm bad on the phone too, so I'll leave it here, take my dog for a walk, lay in the grass outside, stuff like that.
That's awesome. Taking the time. I remember after my head injury, obviously not the same. I saw myself as bigger in the mirror. immediately it changed my perception of self. I would look in the mirror. I was excited about it, but I was also in a lot of pain, and I couldn't like sit indoors where there was a lot of light. So the quality of like going to the beach, going in the water, that was probably the most helpful thing that I did in that time. And I hear you saying you really enjoy that. Do you
Yeah.
experience any, like when you see yourself or you like you think about yourself, do you see a different person now?
I look into the mirror every morning and I'm like, I don't know. It might sound weird, but I'm like telling myself that I'm ready for whatever today brings. I look into my eyes like deep, and I'm proud of who I'm becoming.
Dope, dude. That's awesome. You're the man.
You too, brother. Appreciate you.
Looking forward to seeing your continued
You're
progress.
also the man.
Matt's Instagram we'll have in the description here, so you can follow along with his continued journey. And he always posts pretty interesting workout clips and stuff. So showing off the six pack and whatnot, and while he's doing his cable.
I've cleaned up the garage because Nate told me to as well. So.
Smart.
Yeah, it's like an obstacle course anyway in there.
Yeah. Probably feels a little better to go in there.
Definitely.
Sweet, man. Well, I appreciate your time. Thank you for making this happen.
All good, boys. Enjoy your evening.
Thanks, dude.
Enjoyed it.
See you lads.